Well, what in the world is going on? There are men everywhere who all of a sudden want to look as good as us ladies want to look. I don't know if it's the media, I don't know if it's us putting the pressure on them. We've got Dr. Stephen Mulholland here and Dr. Jordan Soll, Aesthetics and Dentistry, Spa Medica. All right, so the other thing that gentlemen are getting done is they're working on their teeth, aren't they?
Yes.
That's something that I think that men aren't necessarily embarrassed to talk about, though, working on their teeth. Is that a new phenomenon?
Well, we find, like Dr. Mulholland, we find that probably about 10 to 15% of our aesthetic enhancements, teeth and gentlemen.
Teeth and gentlemen. Well, let's take a look as Dr. Soll gave his male patient a whole new smile.
Usually when I'm shooting dental stories, I'm talking about women.
More and more men are seeking out cosmetic dental treatment. We're going to be recreating his smile.
And how do you do that?
Well, initially we had to have the teeth lengthened, so he worked with our gum specialist, Dr. Olivia Silvestri, and she repositioned the gum tissues to make the teeth look longer, more youthful in appearance. Mr. Trevor Langchild, he's going to be creating the actual restorations. So he worked to create the nuances, what color the restorations are going to be, the shape and the contour.
There's a real artwork when it comes to color, isn't there?
There isn't real artwork. It's making sure that the patient's restorations look natural, not monochromatic, and colorful, but yet again, natural.
And that brings us to today, where the actual preparation work is going to be to prepare the teeth, take the impressions, so that Trevor will be able to make the final restorations that are really going to make this smile pop and sort of turn the lights on the smile.
It's been a couple of weeks. Let's see a smile. Wow, Jordan, that looks great.
Well, thanks, Patrick, but please keep in mind, these are just the temporaries. On the top, we have done full crown coverage for the top teeth, and the bottom teeth are going to be porcelain veneers, so just the faces have been changed. We're going to cement in all the top crowns, and we're going to bond in all the lower veneers.
You know what? That made a big difference. Veneers. Let's talk a little bit about braces as well, because that's another way that you can deal with teeth. Are you seeing more men getting braces as adults?
They're more open to the opportunity. Many times if a gentleman will come in and the teeth are kind of in different time zones, we'll need to sort of move them into correct position before we reface them, because sometimes they're just so far out of alignment, even a veneer won't correct the problem. So we do sort of need to move them into the ballpark, and then we can reface them.
Braces first, then veneers.
Yep,
Sometimes happens for people. What about dentures? Remember we used to see the denture cream commercials and do people still use dentures?
Rarely, because now we're addressing mostly the boomer generation.
Right.
And the same thing that Dr. Mulholland's finding, it's the population's getting very worried about the tech-savvy generation coming up behind them. They want to stay good, they want to look good.
Right.
Recent articles in magazines are showing that the beauty advantage is very important. So when they want to keep their job, go look for a new job, they're recently divorced, out on the single scene, they're becoming very, very conscious of how their smile is and how they make that first impression.
And is there any kind of an issue with wearing dentures other than, vanity?
Well, yeah, most likely the retention issue, because when there are no teeth in bone, bone shrinks away. And so it gets very difficult to retain dentures unless you use implants to start helping retain those dentures.
Okay, very interesting. So this real pull away from aging that we've always had as women now happening with men. And the audience is going to love this. Everyone is going to take home a gift bag full of everything you need to keep your teeth looking great. This includes toothbrushes, toothpaste, mouthwash, and floss, thanks to Dr. Soll. Thank you so much for that. We're going to go to break. Stay with us.